Hey everyone, Dr. Krawetz, a Healthy Feet Podiatry, and we were just talking about how great 4K is and how great you can see toenails like this. And we have a great one for you today. This is called Mangled Toe because this patient, and she's laughing, went to another podiatrist and she had part of the nail removed, but it grew back. And it looks kind of mangled because the trauma from the removal of the nail, in addition to the chemical not working, caused the toenail to get completely deformed. So we're going to zoom in on it. You can see it's a very deformed nail, and you've got a nail spicule right here. A spicule is a piece of nail that's not really attached to the main part of the nail. It's almost like a satellite nail. The chemical did not take there, and I think that was the piece that was originally taken. And then this is the rest of the nail. Did they take the rest of the nail? No. Okay, so I'm not sure if it was the trauma altogether, but the nail is really thick. There's fungus in it, a lot of trauma to that nail. And you can see this moves around almost like a loose tooth right here. So it's like wiggling a tooth. So the only thing is we can't tie a string to it and the other end to a door and actually slam the door to pull it out. We actually have to do it surgically. So we're gonna put a tourniquet around her toe. And I'm gonna do this nice and tight. And what I'm doing is exsanguinating the toe. We've been through this many times on other videos, and this is just pushing the blood out of the toe, but she still may bleed a little bit because she does have swelling and varicose veins already. So patients with varicose veins tend to still bleed even with the tourniquet on, but we'll find out in a minute. Now I'm gonna cut a little area here so I can see, and we're right at the mangled portion. And now we can see the toe. So what I'm gonna do is remove everything we see here, clean it out, okay? So we're gonna loosen it first. I'm gonna test her. Any pain here? Do you have any pain when I'm doing this? No? Okay. So this would actually hurt a lot if she could feel it. And what I'm doing is going into the eponychium and I'm following the curvature of the nail and it basically going over the top of it to where it falls down. This gets a little trickier back here. I'm actually not digging, but I'm actually pushing this instrument back into the nail eponychium. But it's all by feel because some of it's attached, some of it there's nothing here because a tiny bit of it, some of the cells were killed initially, but most of it's still there. So now we're gonna remove the piece of nail. We're gonna come over the top. I do this differently than everybody else. I come over the top of the nail and back underneath. So I'm actually following the contour of the nail. And if you can see, I have a curved stat. So you can see that curved stat is actually helping me because it's going upward, so I'm not digging into the nail bed itself. I've got it to a certain point here where I can actually open the hemostat, and I'm gonna stick my other hand around here, open this stat and loosen it up, and you can see it loosening, and you can actually hear it. Almost like, I guess, I always compare everything to celery, but it sounds like celery crunching.
What kind of celery are you eating?
I don't know, the kind that sounds like toenails being pulled off. Okay, so now we'll clamp this, and we're gonna pull the main part of the nail off here. I'm gonna slowly do this. You okay?
Yeah.
Okay. You're not feeling anything, right? No. So this is the part that I worry about over here because that can actually break off, and it looks like it's all intact, which is great. You see how it's just coming off there with a little bit of the dead skin that forms, so it's actually perfect. It's coming off there perfectly, just like peeling a piece of celery. I'm just gonna compare this whole thing to celery at this point. Now we got the whole nail off, and you can see that's a large chunk of nail. Almost looks like a parrot beak if you look at it. I mean, it is thick.
Oh, yeah.
Either that or a smashed piece of celery, right? So we'll put that over here. I know, celery seems to be
ruining celery for everybody.
Yeah. So if you like celery, you may not like it anymore. But anyway, we're gonna stick this stat on the side here. And what I did was come in from this angle because I wanna turn this counterclockwise to pull this side out to make sure I have it. And I can see already that there's a piece or something in there that's not coming. I'm gonna clamp it further back. There it goes. Now I can pull the whole piece out. And now, there it goes. You can see how nice and clean that is. And I'm able to get the whole piece at the eponychium out. And I'm pulling it obviously from proximal distally to get the whole thing out, including the callus tissue. And you can see now when I wipe that off, nice and clean. You don't see anything in there. I've got the entire mangled piece of nail out of there, and the remaining leftover chunk of mangled nail out of there too. There's still trauma to the nail bed. If you look right here, that trauma is actually the trauma from the nail being so mangled and digging into the toenail bed itself, all this area right here. Because when I came under the nail, I had this hemostat flipped upside down this way. So it was actually turning up this way, so it wasn't causing trauma. So that's from the nail digging in there. So that'll all heal in nicely when it's done. And it actually looks, cosmetically, it doesn't look that bad after this heals. So we're gonna put chemical here, sodium hydroxide, and you can see it turn white as I do this. And that way we know the chemical is taken. I'm still drying the nail bed. I like a very dry nail bed, so we know that the chemical is taken. And a lot of times what gets missed is in the corner, so I'm actually gonna make sure I get extra here back in the corner here so she doesn't get another nail spicule growing. And as I'm doing this, you can hear it almost clicking over the nail bed itself, and that's because the toenail was so mangled up that it caused abnormal ridges in the nail cells that are there, and it caused dysplasia. Dysplasia means that the cells have grown differently, thicker, and more coarse than normal of the nail matrix. But that's not going to matter anymore because we're going to kill those cells. So it's not going to be able to produce anything. And that will flatten out with time. It will flatten, and the skin will actually adhere to the area where I'm putting the chemical. And it'll look nice and neat when it's all healed up. So we'll do one more stick here for another 10 seconds. And you're feeling okay up
Yes.
there? Okay, good. You're learning a lot about toenails, more than you ever wanted to know. So do you eat celery?
I do.
Oh, good. Blue cheese or ranch? That's what they always ask when you eat celery. Do you do it with blue cheese or ranch?
When I eat it, I like to put a little peanut butter on it.
Oh, do you really? Oh, that's good too. Yeah, celery and peanut butter. All right. And now we're gonna take some vinegar, put it down there. Okay.
What's the vinegar do?
The vinegar neutralizes the chemical and it washes it off of there. So you get less of a chemical burn afterwards. And the last thing that we're gonna do, we're gonna take this off and we'll see if she gets a lot of bleeding or not. Probably not, because there is epinephrine in the injection. So she's not bleeding too much. I'm gonna put this on the nail bed, and then we're gonna cover it with some gauze. And we're gonna use the same blue tape, but this time we're obviously not gonna do it as tight as we did before because that would cut off her circulation, but snug enough that it causes compression so she won't have as much swelling afterwards. And that's it. It's got a nice blue toe. So that's it. Mangled toe's gone. I'm gonna show you the toenail. This is kind of cool to look at. And you can see it compared to my face. So it's a pretty big chunk of nail. And it's very mangled when you look at it. You can see when you look at it, yeah, 360 degrees, turning that thing around. It's pretty significant. I'm pretty impressed by it too, and I see a lot of these nails. So she's gonna be a lot happier without that nail. When we leave here, we're not gonna film this, but she can say her goodbyes to the toenail. So she's not gonna be seeing that nail again. We're gonna get rid of it. Biohazard, that's how we get rid of this stuff. If you like what you see, subscribe to our channel, and we'll have more great videos for you in the future. Thanks.